Hey,
How are you doing?
I'm trying to get my face in the screen, but I'm good. Like
Your
maybe if I
face looks
slouch.
great. I love the do.
Oh, yeah, I know. So I had an embryo transfer before, and once the hat goes on, the hat stays on because
Well, you
there's
look the
nothing
part.
helping this.
You absolutely look the part. I am excited to be here with you today.
Me too. Thanks so much for inviting me.
Of course. So I see that people are trickling on, and that normally happens.
Yeah.
We're also going to be recording this, so we'll be able to show your fans and our JFF followers the recorded version afterwards.
Sure.
So let's do this.
Yeah, awesome.
All right. So, hi, everyone. I'm Ilana Frank. I am the CEO and founder of Jewish Fertility Foundation. We are a 5-year-old organization. We are a community-based organization that launched in 2015 in Atlanta, Georgia, and our second location is now in Cincinnati, Ohio. We are hoping to expand to 15 more locations in the next 5 years. So, like many of us in this space, it is very personal. Infertility is very personal to me. I started my journey when I got married over 11 years ago. I thought, you have sex and you have babies, and it didn't go exactly as planned for me. Luckily, we were living in a country in Israel where they offered socialized medicine. And I was able to take advantage of that in the sense that my first two children were essentially free, paid by my taxes. Um, and it was not easy. I still encountered the same emotional stress that others did. It was really hard on my marriage. It was hard with my husband. My family didn't know about what I was going through, also because they were back in America. But, and I literally thought, I know people say this, but I literally thought I was the only person in the world going through this. And the internet was very different, over 10 years ago. And I didn't even know what to search or how to talk about it. It was hard. And when I
Mhm.
moved back to America with two little kids, I was just talking in a pool with other moms, and we were just sharing kind of our experiences around fertility treatments. And I was shocked at how expensive their journeys were to having a family. So our organization started. Oh, and not to mention, I struggled still for 5 more years. I knew my family was not complete. Um, I was traveling back and forth to Israel to have more embryo transfers done, leaving my babies at home. But I just knew my family wasn't complete. People were saying, focus on your existing kids, love your existing kids. Obviously, I did. I just knew I had more to offer. My husband and I turned to adoption. We failed at adoption. It was not an easy process and very expensive. Ultimately, I was able to receive a donated embryo, which is a whole nother level of it's totally different. And today I have an 18-month-old from an embryo donation. So do I feel like my family is complete? I don't have a choice now. I feel like I'm 41. Like my husband will divorce me if I try to even engage in the process. Trust me, for real. But the choice wasn't mine. Like the whole process, the choice wasn't mine, and that's not fair. And today, Jewish Fertility Foundation steps in and kind of fills that gap. We offer three things. We offer emotional support. Money is important, but emotional support is almost equally as important. In Cincinnati, we offer free support groups to anybody, regardless of religious background. Of course, today everything is virtual, which sometimes makes it easier. And we also offer a Fertility Buddies program where we match up veterans of infertility with people going through it today. We do offer money. So that's really important. And we're so excited to be a partner with Bethesda Fertility. So we do offer up to $7,500 of grant money. The money goes directly to the fertility clinic. And we also offer discounts to our grantees, as well as a $5,000 interest-free loan. So you can actually leave our offices with a chunk of change, which does help. And then the third piece of our mission is educational training. So we do things like this, where we kind of are able to share a little bit about the doctors we work with. And we also have tons of social media trainings like Pathways to Parenthood or Loving Someone with Infertility, which will really help your family and friends and your parents help you understand a little bit better how they can support you during this crazy journey. So enough about me, enough about JFF. We are here to learn more about you. We are so excited that you became a part of Jewish Fertility Foundation. Can you just tell us a little bit about how you learned about us and how you got started working with us?
Sure, absolutely. So I did my fellowship training in St. Louis. I know this seems like a big stretch, but you'll see where I'm going with this. So in
I'm ready.
St. Louis, they're on the border of Missouri and Illinois. So in Illinois, they have an insurance mandate for fertility coverage, and in Missouri, they don't. So when I was a fellow and I was training, half of the patients in our waiting room had their fertility treatment covered, and the other half didn't. And I saw, and actually our group published some studies about how insurance coverage affects fertility treatment. And it surprised me so profoundly that whether you have insurance coverage or not affects your care and your success rates, even in some patients. And so when I started out in practice, when I came back to Cincinnati, Cincinnati, Ohio, we are not a mandated state. Some patients have coverage, but most don't. And, to your point, this isn't a choice. You're not choosing to have difficulty or struggles in creating a family. And so, here at our center, we wanted to seek out resources to provide funding for our patients. And surprisingly, it's really difficult to find sources of funding for anything, in this day and age. But through a friend, I came to learn about Jewish Fertility Foundation. And like you said, Alana, it's not just money, which that's a huge help, but it's the emotional support, the fertility buddies, the education. I mean, there's so much involved. It's such a comprehensive program that we were thrilled to partner with you guys to have these resources for our patients.
Thank you.
Yeah.
And we appreciate you also serving on our medical advisory council. So that's
Sure.
where when people apply for grants through the Jewish Fertility Foundation, we actually have doctors from each of the clinics that we partner with who get to review the applications, make sure that they're really eligible for the grant and for the treatment. So tell us, do you have a specialty when you're, is there something that you really enjoy focusing on?
Yeah. So everything is my answer, but really there's a couple areas that I really focus on in my practice. I have a comprehensive practice, so I deal with all fertility diagnoses, endocrine diagnoses, but there's two really that I tend to gravitate towards. One is PCOS, or polycystic ovarian syndrome. Very, very, very common. Lots of women are affected by it. Some women are able to have children without assistance, and some aren't. And it's such a complex syndrome that I feel like a lot of patients with this diagnosis just get this label and they don't get any explanation. They don't understand their specific subtype. They don't know what they should be doing for lifestyle, for childbearing. I mean, it's so complex. So that's one of my big areas of focus, and one of my passions is treating patients with PCOS and really educating them. The second big area is recurrent pregnancy loss, which it's a tough field. It's a tough area, but these are patients who generally do get pregnant, but they have difficulty maintaining the pregnancy. So just emotionally supporting those patients through their journey and finding, sometimes we say the right cocktail or the right voodoo or, whatever to help them maintain that pregnancy is another one of my passions.
And you shared some things with me personally about your own family building journey that I didn't know prior to this, us preparing for this call. But I think sometimes, and I say this, that our fertility doctors, my fertility doctors, they become a part of my children's story. Like, we do sometimes have a God complex, and we think that the fertility doctors are just sometimes not human because of the work that you're doing. So we like to make you more human. So tell us a
Yes.
little bit about your own family building experience.
Sure. I am human. I'm very human. Like I
I
feel
think
like today is
so.
a Monday. There's a huge cup of coffee behind my phone over here. So,
This is my
yeah.
third. I understand. Yes.
So, when I came out of fellowship, my husband and I moved back to Cincinnati, and we had always wanted to start a family, but we had just moved. We just bought a house. I had just started in practice, and we weren't ready to really start our journey at that point. And so I did some fertility testing on myself, which you shouldn't necessarily do, but I did. And I found out that I have a condition called diminished ovarian reserve. So, in short, just to keep it short and sweet, it means that my ovaries don't function as well as they should for my age. My ovaries act older than my age. And that can really make it difficult to get pregnant, especially if you're not being aggressive and trying to get pregnant quickly. So, I was terrified, and to hear that diagnosis and to know that, oh my gosh, I might not be able to have a family. It's crazy. It's tough. And so fortunately, again, I do work in the fertility field, so I was able to go through a cycle of IVF, and I was able to freeze some embryos, so that when my husband and I were ready to start a family, we would be able to hopefully conceive without as much difficulty. So my embryos were stored back in our cryo tank where all of our patients are. And, a couple years later, we decided we wanted to start trying. And we decided to try on our own for a few months before we used the embryos, again, just because we have a limited number. And in case we wanted to have future children, we thought, let's just try, to see if it happens. And actually, we did conceive spontaneously after many months of trying. We conceived twins, which it's interesting because women with diminished ovarian reserve do have a higher chance of twins because we have dysfunctional ovulation. So I have twins, Emma and Gus, and I have embryos frozen and currently just letting them hang out until
How long can embryos stay in the freezer?
forever. We think
Forever.
indefinitely. I mean, I've gotten people
Hmm.
pregnant with like a 15-year-old embryo. So
Science is so
yeah,
crazy. Wow.
it's crazy. So yeah, I mean, and that's one of the cool things is, and I know my patients really appreciate is I know what they're going through because I went
Right.
through it myself. And when I say like, oh, IVF feels crampy, I know that because I did it.
Right.
So yeah,
Right. That's helpful. Well, thanks for sharing
yeah.
that. So tell us, why did you want to become a fertility doc?
Because it's amazing. I mean, I was thinking about, I always think about this question because we teach residents in this program, and I get that question from residents all the time who are trying to decide, do they want to subspecialize? Do they want to keep doing general OBGYN? And the short answer is because it's amazing. I mean, as a fertility doc, you have so much continuity with your patients. You are a doctor, you're kind of a therapist, you are a friend. Um, you're almost a family member to some patients because you're with them throughout that whole journey. And then we see patients back, for second
Hmm.
baby, for third baby. And it's just such an amazing feeling to be part of that. The highs and the lows. I mean,
Right.
that's another, point where the residents on our service are always like, oh, your job is so cool. You get to help people get pregnant. How happy. And I'm like, it's not always happy, but it's to support somebody through that journey and
Sure.
be able to provide that care is just, I mean, it's amazing.
Thank you. So
Yeah.
let's talk a little bit about biology and just the science the science behind for some of our newbies who are going to be learning today. They're just entering this space.
Mhm.
Perhaps they're investigating to see if you're the right doctor for them. What happens when they come to you? What are some of the first steps and first options that you might offer one of your patients?
Sure. So, first off, patients should not, and I have white coat syndrome too. When I go to the doctor, I freak out. I mean, it's normal, but Coming, a lot of patients when they get here, they're nervous, they're scared, they're afraid they're going to hear something that they don't want to
Mm-hmm.
hear, right? That we're going to find something bad.
Sure.
And the first appointment with us is really low key, low stress, low pressure. Really, what we're doing is just finding out about you as a patient. What brought you here? How long have you been trying? What's your history? What have you done up to this point? And then we'll do some testing. So
Mm-hmm.
at our center, we really follow the approach that every patient is different. And there are big buckets of fertility therapy, like oral medications, injections, in vitro. So there are big groups that patients fall into, but within each individual bucket, we try to really customize care for patients. So at that first visit, we're doing a ton of testing. We're looking for a reason why a patient's having difficulty conceiving, and then we are kind of going through the treatment options
Mm-hmm.
for what might work for them once their blood work comes back. So a typical journey, patients usually start with oral medications to induce ovulation or increase ovulation. And then if that doesn't work, it's kind of a stepwise approach all the way up through in vitro.
Okay.
Mm-hmm.
And then once we get to IUI, can you
Mm-hmm.
share a little bit about what that is, what that means, and
Yeah.
how that works?
So IUI and patients often get IUI and IVF confused, which I mean, why would you make them so similar? I don't know. But IUI is intrauterine insemination. And basically, how I explain it to my patients is I'm your technician. So everything happens naturally still inside the body.
Mm-hmm.
Fertilization happens in the body, implantation, ovulation, everything. All I'm doing is assisting the process. So basically, with an insemination, your partner or frozen sperm, or you have a sperm source that we
Mm-hmm.
then wash, concentrate, pull up inside a little catheter, and insert it through the cervix into the uterus. It's a quick procedure. It takes like 2 minutes, and it's applicable to a lot of different patients. Patients with male factor infertility, where the sperm count isn't necessarily that great, it can help them.
Right.
Patients with unexplained infertility, like let's say you come to my office and I do this huge workup and I can't find anything wrong. It doesn't mean there's nothing wrong. It just means something subtle isn't showing up on the testing, and an IUI might help with that. So yeah, it's quick,
Mm-hmm.
it's easy, it's pretty low discomfort, and then you kind of go back to your life and you wait that wonderful 2 weeks to
Yeah.
see if it worked out.
Can you share the cost range
Mm-hmm.
of that procedure?
Yeah, sure. So it's as with everything with fertility, it's very difficult to pinpoint because who knows what's covered. But in our practice specifically, what most patients expect, usually because we do an ultrasound to make sure that the ovulation is going appropriately. So that's usually covered by insurance. If
Okay.
not, it's a couple $100s. The insemination itself runs around $400. That includes the lab fee to process the specimen, my fee to do the insemination. So it's pretty standard with a lot of the rates in the area right now. Medications obviously are an additional cost
Right.
on top of that, but yeah, so around somewhere between 400 to 600 a cycle, plus meds, depending on your specific
Okay.
plan. Yeah.
I know sometimes people come to us and they're like, we have no idea what to expect, no idea how much it's going to cost. It's daunting.
Yeah, and there's a
That's
huge
helpful.
range too. Every
Sure.
practice is different. So,
Sure.
yeah.
And then do the same for IVF. What is IVF? And tell us a little bit more about that.
Sure. So IVF is kind of the big guns that we have, and it is in vitro fertilization, is what it stands for. And basically, it is our treatment for lots of different things. Couples who have done multiple cycles of oral meds have not been successful and are now moving to the next step. Patients who have blocked tubes, patients with bad endometriosis.
Mm-hmm.
And the reason IVF is so effective is because it answers all those little questions for us that we can't answer. Like, what does the egg look like? What does the egg quality look like? Embryo quality. Are the sperm actually fertilizing? So it answers all those questions. So basically, very briefly, what's involved is a patient takes medications to stimulate the ovaries. These are injections, and the goal of these medications is to get as many eggs as we can safely per cycle so that we can play the numbers game. The more eggs we have, the more we have to choose from. We retrieve the eggs in a quick outpatient surgical procedure. It takes 15 minutes, and we do use anesthesia for our retrievals. And then once the eggs are removed, we fertilize them outside the body with the sperm, either by just kind of plopping the sperm on the egg or injecting the sperm into the egg, which is called ICSI. Then we grow the embryos out for anywhere from 3 to 6 days, transfer the best, usually one, sometimes two, back into the uterus.
Mm-hmm.
And then we see if it worked. And, pregnancy rates with IVF are the highest you'll get with
Right.
any fertility treatment. From start to finish, it can take anywhere from 3 to 6 weeks, just depending on the lead up.
And, I think sometimes our clients or patients, and even when we're talking with loved ones who are like intended grandparents or family and friends, they're like, oh, but they're doing IVF, so they're going to get pregnant.
Yeah.
And what we have to, set realistic expectations that it's just not always going to work. There is the, biology and science, but there is also, sometimes it just doesn't work.
Yeah. And the unfortunate thing with IVF, like I said, we find out sometimes why patients weren't getting pregnant. And sometimes it's an egg quality issue. Sometimes it's a sperm quality issue. And we do everything we can to correct these factors. But sometimes, if I take a patient through a cycle, she is not successful, I'll alter the plan, we'll do something different. If the same thing happens again, low embryo quality, no implantation, that sort of answers our question for us. But yeah, I wish it were 100%. My job would be a lot easier.
Right. But today there's so much you can do. There's so many options. There really, I have lots of faith. Yeah. Amazing. Is there anything else you'd like to share about your practice, about yourself before we head off?
Yeah, this was so quick. It was wonderful. So just a little bit about our practice. We are the Bethesda Fertility Center, and we are a small practice north of Cincinnati. There's just two of us here. It's myself and my partner, Dr. Izzy Robertshaw. And it's a very sort of close-knit environment. She and I mostly take care of our own patients, but we do have some cross coverage. But we know about all of our patients here. Our nursing staff is great. So it's very different. You'll find that if you're looking at different fertility clinics, every clinic has a different feel. And we tend to sort of see ourselves as just, kind of a smaller, more individualized practice. And we like to make ourselves available to our patients when
that's huge.
Yeah. So
when I have to answer my phone and kind of help navigate for our clients, like just the communication between nurses and doctors, it's hard, especially with some of the larger practices. So you really, people really have to figure out what they're looking for, and communication is so important. And I think that that's a really nice offer.
Yeah.
Amazing.
Yeah.
Amazing. Well, this has been very, very important. And it is going to be saved so that, people who want to check you out or check your clinic out, it'll be available to them. Again, we are the Jewish Fertility Foundation. I see your patients loving you. I knew that was going to happen. We are the Jewish Fertility Foundation. Our services are open to anybody regardless of religious background. Please follow us on Instagram and Facebook. We have educational trainings and opportunities always. And if you're interested in learning more about our fertility grants, you can honestly just reach out to me, Ilana, at jewishfertilityfoundation.org. And we are excited to partner with you. Thank you so much for your time.
Thank you.
And let's do this. Let's make some babies together.
Let's do it.
Thank you so much.
Thank you. Have a good rest of your week, okay?
You too. Enjoy
Bye,
your day.
everybody.
I'll talk to you later. Bye-bye.
Bye.